Massage therapists know better than anyone the healing benefits of bodywork are not just for a lucky few. Rather, massage is for every body. ABMP's Massage is for Everybody Week, celebrated July 19th through 25th, is part of a bigger year-long movement grounded in advocacy, awareness, and inclusion. Join ABMP in celebrating the powerful benefits of massage and the meaningful role you play in your community. Together, we're helping to expand access, support underserved populations, and elevate the profession with compassion and professionalism. Learn more at abmp.com/massage-week. Elevate your bodywork career with Anatomy Train's Structural Integration Certification, ATSI. Discover how to map the pattern and shape the change through inspiring lectures, hands-on body reading, and practical techniques you can use in your practice right away. Join us for ATSI Maine 2026 to 2027, where Tom Myers will personally kick off this transformative professional training. Learn more at anatomytrains.com/ATSI. At Heights Retreats, massage therapists build stable and meaningful careers rooted in wellness and care. A place where therapists are dedicated to delivering exceptional care to the guests, not to filling their schedule. Heights Retreats care deeply about their therapists, our profession, and wellness itself. Grow with Heights as they evolve into a wellness-driven future. Visit heightswellnessretreat.com for more information.
Hi, everyone. Welcome to the ABMP podcast, a podcast where we speak with the massage and bodywork profession. I'm Rachelle Clausen.
And I'm Nicole Trombley. We're both full-time massage therapists who also love to study, write, and teach. Rachelle and I write the Anatomy for Touch column for Massage and Bodywork magazine.
In fact, we love teaching so much, we created AnatomySCAPES, a continuing education company for hands-on professionals.
Today, we are launching a series of eye-opening interviews with fascia research scientists from around the globe.
This research is so relevant to massage therapists because fascia comprises such a large part of the tissues we touch. And it's not just about techniques. It's more foundational than even that. It's about understanding the components, the organization, and the relationships of the tissues that help us comprehend what we are feeling beneath our hands.
Exactly. We only ever physically touch skin as massage therapists. That's the barrier that holds everything else inside. But massage therapy is all about influencing what lies beneath the skin. How we push, pull, compress, or distract is affecting the tissues we can't see. And the best way to understand that is to really get a handle on what is connected to what, where, and how.
I had a chance to sit down and chat with world-renowned researcher Caterina Fede, who works in the Department of Neuroscience at the University of Padua, Italy. Best known for her work with the fascia research team led by Carla Stecco, she delves into the topic of superficial fascia, with a little bit also about her work studying the effects of sex hormones like estrogen, progesterone, and relaxin on fascia.
Now, I'm going to fangirl for a moment here. Caterina is seriously one of my favorite fascia researchers. Her work has been really focused on exploring the molecular aspects of fascia, which is what helps us understand what fascia is made of and how fascia responds to everything, including manual therapy. This is the stuff we teach with AnatomySCAPES: cells, gels, and fibers.
Totally. It all starts with understanding the anatomy. Once you understand that, you have the framework to understand everything else. If you don't understand the anatomy, then pathology won't even make sense. You need to know the baseline before you can understand the variation.
Caterina is such a clear speaker, boiling down some complex topics to very clear elements. But it's a lot to soak in. We'll be commenting along the way in this conversation, but you might want to listen to this one more than once.
And then once you've listened, if you still have more questions, you can always reach out to us at either Rachelle or Nicole at AnatomySCAPES.com. We always love hearing from you. Let's get into the conversation.
The interview begins as Caterina describes her role in research work in Italy.
So first, thank you for your research. Also, thank you for being here and taking some time to talk to us.
Thank you to you, Rachelle.
Yeah.
I work in the Department of Neuroscience at the Institute of Human Anatomy in Padua, at the University of Padua, in the team of Professor Stecco. And I started to work about fascia more or less 10 years ago to understand the microscopic aspects world of the fascia. So first of all, we started from the deep fascia, but then we are moving also on the superficial and the visceral and the neural one to understand which are the different components and the different roles of the different fascial tissue.
Okay, quick recap. I know we're less than a minute in here, but it is worth pausing for just a moment. She just described her research is in microanatomy.
That's the land of cells, gels, and fibers.
And did she also just say that she has been studying 4 different types of fascia?
Yes, superficial fascia, deep fascia, visceral fascia, and neural fascia. Rachelle, you're always asking which fascia where.
Right?
And this is why there's more than one type of fascia. We're probably most familiar with the deep fascia that's so interconnected with our muscles. But our organs, the heart, the liver, the uterus, are also supported by fascia, the visceral fascia, and the entire nervous system, from the sciatic nerve to the brain itself, is surrounded by neural fascia. The superficial fascia is one part of the fascial system that a lot of Caterina's most recent research is focusing on. We don't tend to talk about the superficial fascia too much, but it's starting to get a lot more attention lately, which is good because we interact with it in every massage we give. It lies closest to the surface of the skin.
It's so clear to hear it laid out this way. And Caterina will explain some about how they differ structurally and functionally in just a minute. But first, she's going to tell us what she spoke about in her conference presentation the day before this interview in Germany.
I spoke about sex hormones and how they affect the fascial tissues. So this can help to understand why women are usually much more affected than men of musculoskeletal pain and especially chronic pain.
In this next part of the interview, Caterina takes us through the first layers of fascia that we feel when we touch, squeeze, and massage the human body from surface to deep.
When listening to this part, keep in mind that this explanation is based on the most current anatomy research, and it may be more intricate than what you studied in massage school. It does, however, perfectly reflect what you can see in the dissection lab, and has a really beautiful appearance.
We've become lovers of fat.
It's hard not to in the context of the fascial system. Once you understand how important it is, not just the fat, but the fascial structure it's organized within, and get to see it with your own eyes, it's truly amazing.
Most of us never really studied fat that much in massage school, or how we should work with it. Culturally, we love to hate on it, but we all have it. I wanted to know, what do the scientists think? As Caterina describes the layers, picture a layered cake in your mind, or even better, layers of blankets and linens for your massage table as you follow along. Think of the superficial and deep fascia as thin sheets, and the superficial and deep adipose tissue as fluffy blankets. Listen carefully, and you should end up with this order: skin, first fluffy blanket, first sheet. Second fluffy blanket, second sheet, and then muscle. Let's listen. What is your perspective on fat in the context of the fascial network or the fascial system? Is there a different way we can maybe start to change our thinking from fat is the thing to get rid of to fat has a role to play? And what is that role?
All the layers from the skin to the muscle are very important. And under the dermis, we can find the superficial adipose tissue. So the first layer of fat that works together with the skin, and it is related also with the superficial fascia. So when you move the skin, also like that, you can also move your superficial fascia, because the mechanical behavior of the skin ligaments, which connect the skin to the superficial fascia, permits to this layer to work together. But you cannot speak about superficial fascia without thinking what there is deeper. So under the superficial fascia, there is again another layer of fat, that is the deep adipose tissue, which permits to connect and divide together the superficial layer with the deeper layers. So under the superficial fascia, we can find the deep adipose tissue, again linked with retinacula cutis profundis, and then we can find the deep fascia and the muscle. So the external layers, so the superficial fat and the superficial fascia, works together with the skin for the thermoregulation, for the exteroception, so you can perceive what is happening outside your body. And the deep adipose tissue permits to separate the external from the internal layer. And the deep fascia works together with the muscle for the motor control, motor coordination, proprioception, and force transmission.
I love how much detail Caterina fits into her description of the superficial fascia here. One thing that really stands out to me is how the superficial fat layer, the superficial adipose tissue, connects the superficial fascia to the skin, so they move together as a unit. But the deep adipose tissue separates it from the deep fascia and muscle.
Except where it doesn't.
Haha, that's true. But we are getting ahead of the story. That part's coming up. But first, let's listen as Caterina explains more about the components and functions of the superficial fascia. The superficial fascia, I think, maybe is a layer of fascia that people are less aware of. I feel like we oftentimes will just say fascia. And what do we mean? I like to talk about which fascia where, because you say the same word, but you're meaning something completely different. You described that it was below the superficial adipose tissue, but can you describe the superficial fascia a little bit more specifically?
Yes. Yeah. The superficial fascia is made of collagen fibers with a lot of water, glycosaminoglycans, fat, and a lot of blood vessels, and also lymphatic vessels, because the superficial fascia is very richly vascularized. But it also a lymphatic plexus, so it is very important also for the lymphatic drainage. And also it is very richly innervated, but especially of autonomic innervation. So these autonomic fibers innervate the wall of the blood vessels, so they can regulate the opening and the closure of the blood vessels that are inside the superficial fascia. And so they are very related to the thermoregulation. In the superficial fascia, we have usually less collagen with respect to the deep one, and much more hyaluronan. The superficial fascia has a lot of elastic fibers also, because it works as a containment for all the vessels and the nerves that cross the superficial fascia.
Which allows it to be more adaptable to those continuous changes, right?
Exactly.
Okay, Caterina just named all the ingredients, the cells, gels, and fibers that make up the superficial fascia.
Yep, the fat cells, the gels made of water and hyaluronan, and the collagen and elastin fibers.
Together, all these components create a stretchy membrane, the first massage sheet that Rachelle asked you to visualize. That sets us up so well for understanding how the superficial fascia provides a supportive, adaptable home for all the activity that happens there. Full of lymphatic vessels and blood vessels, the superficial fascia is really important for our health, including managing aspects of our immune system and circulation.
And temperature control, thanks to all the autonomic nerves that live there too. Let's keep listening as Caterina explains how superficial fascia characteristics are different from the deep fascia, and where in the body the superficial and deep fascia have a very special relationship.
So they are totally different characteristics with respect to the deep fascia that is organized in sublayers, which glide each other. They are more rich of collagen fibers, very well organized in layers, with the hyaluronan in the middle, which permit the gliding. In the deep fascia, we have less elastic fibers, so it's another difference between the two layers. In some specific part of our body, the superficial fascia and the deep fascia are connected, fused together. So there, the deep adipose tissue is totally absent. And so in that specific part, when you move the skin or you have some stimulation from outside, you can go directly to the deep fascia. These particular areas are in the palmar fascia, in the plantar fascia, so you can feel also the objects with your hands or with your feet, but also in the linea alba, in the spine, the back. There are also some transverse lines of adhesion, especially in the joints, because if you move the joints, the skin has to move directly together with the joints and with the deep fascia. So there you have the fusion of the superficial and the deep layer. And these specific areas are the same in all the people. So you can organize your body in specific quadrants. So it is a very precise organization of our fascia.
What I love about this part is the idea that we have fascial adhesions that are absolutely essential and healthy. It's so weird when all we tend to hear about is this idea that we must break up adhesions. Why aren't people talking about functional ones that are healthy and normal? And then, can we palpate them? Do we even recognize them when we feel them?
And what about the function of them? It's really cool to think about what is happening in these regions of the body where the superficial fascia and the deep fascia are fused. In essence, it's linking our exteroception with our proprioception, areas where what is felt from the outside world is being communicated deeply into our perception of our own body. It helps us to orient ourselves continuously through areas like our hands and feet, and at our midline in the front and back, for example.
This is really fascinating to me. Pardon the obvious pun there. Fascia, fascinating. These areas of superficial and deep fascia fusion, called the lines of adhesion, in our massage linens analogy, would be lines where the second blanket is missing and the two sheets fully fuse together.
It's subtle, but you can feel them when you know what to feel for.
And now I ask Caterina a big question that relates to all of us. As manual therapists, is there something that we should include in our thinking when we massage people's bodies about the superficial fascia?
Yes, because when you use the touch, you can obviously make a stimulation in your superficial fascia. Also, to reach the deep fascia, you obviously cross also the superficial one. But thanks to the rich autonomic innervation, you can stimulate a lot. There are some studies which relate the autonomic innervation of the superficial fascia with the neuroimmunoendocrine regulation, with the hypothalamic stimulation, so can be related also to our central nervous system. So obviously with movement, with exercise, but also with manual therapy, you can stimulate also all this network between central and peripheral nervous system.
Fascinating. In case we don't already know this term, Nicole, can you explain what neuroimmunoendocrine regulation is? And maybe a few of the other concepts she just mentioned, like connection between the central and peripheral nervous systems.
Sure. First, though, these are huge topics. But in brief, this is really just the idea that our nervous system, immune system, and endocrine systems, they don't function separately. They work together. And when we have input from the periphery, including from massage, it influences the local tissue and also sends information back to the central nervous system, to the brain.
So what Caterina is suggesting here is we can affect all of these systems through our touch when we massage the superficial fascia.
Yeah, that's it. Amazing, isn't it?
Let's listen to the rest of this section about the effects of massaging the superficial fascia, and then the last part of the conversation where we conclude with a fascinating discussion about what's on the horizon for Caterina's research, including a lot of conditions our clients may currently be struggling with, and what we know and don't know about how to address them.
And then we'll meet you at the end to recap the key takeaways.
Yes, we may be thinking about muscle, but not realizing we're affecting so many other systems through touching this layer that's on top.
Yes,
right?
Because when you move or you treat the deep fascia, you can, for example, treat a densification.
Sure.
So you create much more gliding in your hyaluronan loose layer to restore a correct movement. And also with the movement, you can try to organize much more better the lines of force of the deep fascia. That is related to motor coordination, control, and for a transmission of force. But obviously, with movement and with touch and with treatment, you also stimulate your superficial fascia. You have to consider that they can be stimulated also in a different way.
Yeah. And so, I think what you're talking about makes me think about Swedish massage and relaxation massage. People are like, I don't need relaxation massage. I need deep tissue. And maybe, okay, for sure, there's something to do with the motor coordination system is good, but maybe we can embrace maybe a more superficial work as being very powerful and affecting things on a biochemical level and a neurological level that has powerful and profound effect on their bodies as well as how they feel, right?
Exactly.
Yeah, that's really, really good stuff. I love it.
Thank you.
Is there anything else that you really feel is like that's really on your mind right now that you're excited to dig into deeper? There's something that is of the research that you're either currently working on or where you hope to go with your next chapters of your research? Is it with this or other things as well?
It's also with this. Yeah. I want to study much more the superficial fascia. In the last years, we were a lot focused on that, but I think that there is much to be discovered. Yeah. For example, the talk that I have explained yesterday in this Congress was related to sex hormones and deep fascia. But we don't know if also the superficial fascia, and I'm sure that the answer is yes, if the sex hormones can affect also the superficial fascia, because there are also some pathologies that are specifically related to women, like lipedema.
I would say, for example, can you tell us?
Yes, and I think that there are a lot of genetic and metabolic and inflammatory factors, but also sex hormones, because that can be useful to explain why females are more affected than men. So, for example, the lipedema, in which the superficial fascia is very altered because it becomes thicker, fibrotic, and there are some nodules in the superficial fascia of female patients of lipedema that are much more vascularized and much more inflamed of both acute and chronic inflammation with much more mast cells inside. And the mast cells, again, they can regulate a lot of neuroimmuno and inflammatory pathways. And so I'm curious to understand if also the sex hormone receptors can be altered in that kind of patients.
Okay. That would be my next question, because everyone's like, first understanding the anatomy, I think. You start there. Then you find understanding what's happening in the tissue. But the biggest question always people have is, what about treatment? Now what do I do with this information? Are we at the point where we have any understandings, like what would application of this research, any aspect of this superficial fascia research, that there is specific clinical application that we know?
Yes, because you can treat specifically the superficial fascia for lymphedema, for circulation problems, lymphatic problems, probably also lipedema, but we are trying to understand. We have no guidelines on how to treat that patients, but we are sure that the focus has to be the superficial fascia. The fibromyalgia, for example, also the fibromyalgic patient has surely the superficial fascia altered. So again, touch, the perception of pain, the neurotransmitters, the hormones like also the cortisol, and a lot of other neurotransmitters. And fascia, I think that can be a mediator for that link between central nervous system and peripheral one.
This mention at the end here about lipedema is such a huge topic.
It is for sure one of the big areas of research right now. We could do a whole other podcast on it.
Oh, and I'm pretty sure we will too.
Okay, key takeaways.
Well, first things first, listeners, be sure to check out the Anatomy for Touch column in the summer 2026 issue of Massage and Bodywork magazine. The topic? Superficial fascia, of course. You'll get to see images of the superficial fascia from our work in the dissection lab, and we used a lot of Caterina's research in the article.
So much fun to write about this topic. I think this interview really drove home for me how essential it is to understand the foundational concepts of the micro and macro anatomy of our tissues, to understand not just how they feel, but to help guide the way we interact with them. Knowing that the fat is not just fat, it's a 3D structural scaffolding with a membrane in the middle that is serving the body in a multitude of really important ways and is affected by my touch, helps me slow down, lighten up, and look for the textures of what lives in the tissue before we ever get to the muscles.
Yes, and knowing fascia is not all just the dense, deep fascia of the muscles is really important. And then knowing there are areas where the superficial fascia and deep fascia are fused together to enhance our perceptions just opens up a whole new understanding of how the body works.
There's so much to this topic.
Also, Caterina only briefly touched on the topic of hormones in today's interview. But don't worry. The good news is we're going there. Our next podcast in this series will focus on women, fascia, and hormones with Dr. Katja Bartsch. It's such a huge topic that's unfolding right now. This area of research is so badly needed. I'm really glad it's finally being studied.
If you'd like to share your thoughts with us about this episode or any of our other episodes, please feel free to email us at info@AnatomySCAPES.com. That's all for now. I'm Rachelle Clausen.
And I'm Nicole Trombley. Thanks for listening.
Precision Neuromuscular Therapy has been teaching high-quality seminars for over 20 years across the country. Founded by Doug Nelson, PNMT uses problem-solving skills and precise treatment options to get powerful results for your clients. PNMT seminars focus on honing your assessment and palpation skills to precisely target the source of your client's pain while understanding the why behind the what. Meet us in a hands-on seminar or online in the PNMT portal and let us join you on your learning journey. Learn more at pnmt.org.